Hi, I'm Gil Kennedy, President and CEO of Har-co Credit Union. Today I have the pleasure to speak to Sarah Quinn as our guest for this community spotlight at this wonderful Lyriodendron property. Sarah is the Crisis Response Director, Office of Mental Health, Core Service Agency of Harford County. Welcome, Sarah.
Thank you so much for having me. I'm really happy to be here.
I always like to start these sessions and these spotlights with the opportunity for our guests to tell us a little bit about themselves. So,
hi, as you said, I'm Sarah Quinn, and I am a licensed clinical social worker by trade. I currently have the honor of heading up Harford Crisis Response, which is the sort of first responders emergency services for behavioral health care in Harford County. And so in that role, I sort of oversee our programming, and am responsible for getting all the good folks out to do the good work.
Sarah, tell me a little bit about core services and the programs that you offer.
So Office on Mental Health Core Service Agency is the local behavioral health authority for Harford County, which means that as an organization, we're responsible for sort of the planning, monitoring, management of public behavioral health services in Harford County. And then additionally, in August of this year, so very recently, we have had the opportunity to take crisis response programming in-house and build and operate that program. And so that's a continuum of crisis response services. We have a hotline warm line. We have mobile crisis teams that actually respond out into the community to people who are experiencing crises and provide face-to-face behavioral health responses. And we have a few specialized programs as well that serve Department of Social Services and children involved in those services, as well as children in Harford County Public Schools and people with substance use disorders. We have a peer recovery program in which people with lived experiences and some additional training provide support to folks who may be experiencing substance use disorders.
Is there a crisis line?
Yeah. Absolutely. So if you call 1-800-NEXT-STEP or 410-874-0711, you can connect to our phone counselors 24 hours a day, 7 days a week, 365 days a year. We're always open. We're always available to talk. And if you're in crisis, you should definitely call the line. But if you're not yet in crisis and you just need some help navigating through systems of care related to mental health or other support needs, you can call. If you just need a kind person to talk to, you can call. There's really no wrong door into our services. If you need help and you're not sure where to start, we would love to hear from you and we will get you connected to the right place.
Sarah, when we were preparing for this session last week and we were talking about the spotlight, you spoke about COVID's impact on mental health and wellness. So please share some of your thoughts about that for our guests and our community at large.
Sure. So I think the interesting thing about the times that we're living in is that we're all having a very shared experience and at the same time a very individual experience. And so what I mean by that is this is something that we are experiencing, with the other folks in our community, nation, world. And so in many ways, we should feel sort of more connected, more part of a community, right? Because we have this shared experience. But that's not necessarily how we're all feeling, because we're part of a shared experience that, one, involves a higher level of isolation, separation potentially from support systems that have been useful to us in the past, whether those are informal supports like our friends, our family, or whether they're more formal supports like being able to see providers in person or being able to travel to groups and to school and to all of these things that maybe are a part of our support system. So that's certainly a challenge. Of course, we're seeing the challenges around people who may have lost employment or other income due to the pandemic, right? We're seeing challenges around socialization. And so all of these things are happening and are certainly having an impact on folks. One concept that I'd love to talk about today that I think is really important to think about and I think can sometimes be a barrier to getting our needs met is the concept of comparative suffering. And so comparative suffering is sort of this idea that because I may not have it as bad as someone else, perhaps I should not feel able to speak or able to bring my truth to light to others because maybe I should just be grateful. And so comparative suffering is something that is really intertwined with shame. And it can be sort of an internal shaming. It can be me saying to myself, like, yeah, I have it pretty bad, but like no one in my family's sick. I don't know anyone who has passed away from the illness. So, I still have my job. So even though this is really hard, like I wish that my kids were in school. I wish whatever, right? Like I just shouldn't say anything. I just need to just bear this because it's hard for everyone and I don't have any right to speak. Or it can look like, external shaming from another source, and it's not even meant that way, right? Sometimes we say things that we intend to lift other people up, but really end up sort of making them feel unheard or invalidated. And so someone might say like, oh man, I'm having a really hard time with this. This has been a real challenge for me. And then in order to comfort them, because we don't know what to say, sometimes when people are having a hard time, we say something like, yeah, I hear you, but look on the bright side. At least you're getting to spend a lot of time with your kids. You're having your husband is still working, whatever it might be. And we're saying this because we're hoping like, well, maybe this will make them feel better. But really what we're talking about there is sort of the idea of comparative suffering. The idea that maybe someone else has it better. Like, well, at least you're not like Susie, I heard her sister passed away and just think that could have happened. That didn't happen to you. Like, let's count our blessings. So what we want to try and do is sort of move from but statements to and statements, because these two things don't have to be living in different spaces. They can live in the same space together. And so if we think about being grateful and acknowledging our pain at the same time, that's actually a really easy thing to do. And so you can say, I'm having a really hard time right now. I'm not sure when this is going to be over. It's really scary for me. I feel really anxious. I feel really unbalanced. I feel like I need some help. And I'm also really grateful that, the people I know and love are still well. It's not different. And it acknowledges both. And the reason I wanted to talk about this concept today is because I think it's something that is really almost running parallel with the pandemic, a pandemic of its own, sort of like this comparative suffering. And it's stopping people from sometimes reaching out for the help that they need because they think that maybe their suffering isn't great enough to ask for help. So many people need help right now. Is it really okay for me to be one of the people who are asking for help? And what I want to say is yes, it absolutely is. There's plenty of help to go around. There's help enough for everyone. And if you feel like you need support, if you feel like you need to be heard, if you feel like your truth needs to be validated, then there is space for that. And we honor that. And we want to bring that to light.
Sarah, do you get calls from people that feel isolated in our community?
We think of isolation, we just think of like, I'm alone in my house, I don't have communication. Well, a lot of folks have found ways to have increased communication through virtual means and so forth, right? But there's something to be said for a hug. There's something to be said for human contact and interaction, right? And just sort of that casual sort of day-to-day social experience that we as humans crave.
Sarah, you spoke about the trauma lens. Can you talk to my guest about that?
So I think you have to think of the pandemic in a trauma lens and recognize that for some people this will be a lifelong trauma, right? And that we know that trauma, when the incident that created the trauma resolved, that is not the same thing as the trauma itself resolving. And so, when you think of it through that lens or that understanding, I think that we recognize that there are going to be people who need support from this, potentially throughout their lifespan. And that's okay. Just like any other major event, war, death, major accident, whatever it might be.
Sarah, you spoke about the continuum of health. Speak to my members and community at large about that.
Yeah. Thanks for asking, because this is one of my another little soapbox I love to climb up on, so I appreciate you indulging me. So, there's been a lot of work over the past, decade, couple of decades, whatever it might be, around sort of breaking down the stigma around mental illness and mental health and what it means. And I think now what we're really thinking about is how can we even move past talking about stigma into just talking about the normalization of mental health and looking at mental health on a continuum. And so instead of saying that we have two things, right, we have mental illness and we have mental wellness, well, that's not really the reality for most of us as humans. What we have is mental health, and all of us, day to day, week to week, month to month, year to year, are going to move sort of back and forth on that spectrum of mental health, mental wellness. And some days we are going to feel more mentally well, and some days we are going to feel less mentally well. And we need to recognize that that is sort of part of the human experience, just like any other health. And so as opposed to saying to someone, it's okay to seek help, right? We should say it's normal to seek help. We should all seek help. In fact, we should think about accessing mental health care in the same way that we access physical health care, which is that sometimes we see a doctor or a provider when we're not seriously ill. Sometimes we just have a bad cold and we feel like we'd like to go in and get a little help on that. You know, same thing. Sometimes we all just need a little support. And it doesn't mean that we have some sort of serious mental illness. It means that we're a human living with emotions, feelings, and could use support from another human. Seems pretty normal. And then the other thing is sometimes in physical health, we don't even wait until we're sick, right? We have checkups. And so, I would love to see us move to the same thing where we're just doing regular check-ins with people because, our mental health impacts every aspect of our life. It's the reason we can get out of bed or not in the morning for many of us. So I think it's just really important to not sort of think of, this whole group of people over here who have mental health issues and this other group of people who don't. Like, I would argue that those two groups of people don't exist, and we're all just there together doing better or worse on any given day.
Sarah, I always like to end these sessions with the opportunity for our guest to speak about a thought or share some perspective.
Okay. Well, I guess, the thing that I would just sort of challenge everyone to do is just to, as you're coming across people, as you're interacting with folks, to just try and extend a little bit of grace, to recognize that, we don't know the journey that anyone else is on, and, whatever small kindness we can offer someone. And then on the flip side of that, whatever kindness you can offer yourself, sometimes that's even harder, right? And whatever grace and kindness you can offer and extend to yourself during this time, do it. And if that means that you're going to reach out and call the hotline, or if that means you're going to seek out services, like, amazing. And thank you for, thinking of yourself and being willing to take care of yourself. And
to conclude, Sarah, what is the hotline?
Yeah, so again, the hotline number is 1-800-NEXT-STEP, or locally 410-874-0711. And again, operational 24 hours a day.
I want to thank our members and guests for the views that we're getting on these spotlights. Hopefully you found this spotlight to be something of great importance. I want to remind everybody to please like and share us on Facebook. Thank you.